Falling pregnant can be as simple as just having sex, but for many couples it's not that simple, however. Did you know that 1 in 6 couples has troubles conceiving? When we talk about problems with infertility, we actually use 2 broad groups, 2 broad categories. We talk about the infertile group and the subfertile group. Infertile is like impossible, meaning that it could be because there's no sperm, there is no vagina, there is no cervix, there is no uterus, there are no patent or open fallopian tubes, there are no ovaries, there are no eggs coming from that ovary. When we talk about subfertile, we're meaning that perhaps there is some sperm, but there's less of it, or it's not swimming properly. Perhaps the sperm can't get through the cervix. Perhaps there's a polyp inside the uterus. Perhaps there's a problem with one of the fallopian tubes. There could be an adhesion or some scarring. Or perhaps the woman is ovulating, but she's not doing it regularly. So that's kind of the difference between subfertile and infertile. One is really quite impossible, and the other one is more, say, probable. So what this means is that if you take 100 couples, 85 of them will be pregnant after 1 year, but then about 15 of them won't, and perhaps they need help. They may be infertile or subfertile. Broadly speaking, in practice, there are 3 different ways that a couple may conceive. Naturally, spontaneously through natural sexual intercourse, or with the assistance of a doctor like myself. And that's in the laboratory where we use either intrauterine insemination or IVF. The way it all works is that an egg needs to meet the sperm. Now, you have to get the timing right. And what that means is that you have to have sex at the right time. Now, you can have sex every single day, minus 3 or 4 days. And if those 3 or 4 days fall around your fertile window, you won't conceive. So it's really important to know when to have sex at the right time. If you have sex at the right time, imagine you're a sperm. You've entered the vagina. You've been one of those very few sperm that have actually made it through the cervix, because the cervix has mucus, and the mucus can actually be quite receptive to sperm or not receptive at all. It's a bit like a stop sign, stop and start. When the cervix is quite receptive, you'll have the go sign. It'll go. The sperm will move through the uterus. Then the sperm has to be swimming through the uterus. And then what it has to do is find either right or left exit, because as you know, only 1 ovary has a go every month. And it's very important for that egg and sperm to meet in the right spot. Now that right spot, where is it? It's in the fallopian tube. And at the same time, they have to see each other. They have to have signals from one another. The sperm knows where the egg is if it's in the right tube. There are some critical time limits. After an egg has actually left the ovary after it's ovulated, it only has about 12 to 24 hours to be fertilized. The sperm can hang around in the genital tract for about 5 to 7 days. But the key thing is that the sperm needs to be there before the egg. So you've been trying now for a year to get pregnant and you're still not pregnant. What do? Well, I think it's important that you talk to somebody. Now that somebody could be your GP or a specialist doctor like a gynecologist. It's very important that you get more information on why perhaps it is that you're not conceiving. Is there anything that you can do naturally yourself at home to help you get pregnant? Because at the end of the day, we all like to avoid any medical intervention. For many people, medical intervention is necessary and unavoidable. And thankfully, there are options for you. One option is intrauterine insemination. And what that involves is a man delivering sperm into a jar in a lab situation. That sperm is prepared, then put into a catheter. That catheter is then inserted into the woman's uterus. That's called intrauterine insemination. Another option is IVF. IVF stands for in vitro fertilization. In vitro, glass in Latin. And you've probably seen a test tube in the lab when you were in high school, perhaps. This is a test tube, hence the term test tube baby. In vitro fertilization involves obtaining sperm from a man, and at the same time we obtain eggs from a woman. Once we have obtained those eggs and that sperm, we then put them together in a dish. We hope to make embryos when we've done in vitro fertilization That's the purpose. We're creating embryos. Embryos may often sit in a little dish like this, and they're incubated. They're kind of nursed in the lab for a number of days. The aim then is to put back a single embryo, and then we hope that that embryo becomes a live, healthy term baby. The menstrual cycle occurs for one reason only, and that's for pregnancy to occur. It means that an egg has to be released to meet a sperm, so an embryo is made and hence implanted, and hopefully a pregnancy occurs. When we talk about a menstrual cycle, we talk about the length or the time between day 1 of bleeding to the day just before the next bleed. We call that a cycle. Now, typically, only about 15% of women have an average 28-day cycle. Many women can have a 21-day cycle or an up to 35-day cycle. If your cycle is shorter than 21 days or longer than 35 days, you should probably be speaking to your doctor. However, if you have a cycle that's anywhere between that range, this is generally what happens during that cycle. When we're talking about the menstrual cycle, it's important to realize that the ovary speaks to the lining of the uterus, the endometrium. Here you've got a model of a uterus and an ovary. At the level of the ovary, there are 3 phases. The first phase is what we call the follicular phase, when follicles develop. The second phase is ovulation, when a follicle goes pop and an egg is released into the fallopian tube. The third phase is called the corpus luteal phase, or the luteal phase, where a very important organ called the corpus luteum is made to pump out lots of hormones that actually support a pregnancy. At the same time that the ovary is going through its phases, the endometrium, the lining of the uterus, is doing its own thing as well, and it too goes through 3 phases. The first phase is menstruation, when you've got a period. The second phase is what we call the proliferative phase, when there is the growth of the lining of the uterus. And then there is the secretory phase, which is when there's active activity to help that lining become very receptive to a pregnancy. Knowing the menstrual cycle and the phases that are involved means that you'll have a lot more knowledge and hence power to fall pregnant. You'll be able to actually have sex at the right time to maximize your chances of falling pregnant. The reason why you want to know your menstrual cycle lengths is so that you know when you're ovulating. And if you know when you're ovulating, you know when to have sex, and that means you're going to maximize the chances of you falling pregnant. The menstrual cycle is a series of phases that the endometrium and the ovary go through. Essentially, the ovary releases an egg after having gone through those steps, and the endometrium, the lining of the uterus, has prepared itself to receive a fertilized egg. Part of the menstrual cycle is the luteal phase. That's the third phase of the ovarian cycle. During this phase, you've got something called a corpus luteum, which is in your ovary, and it's pumping out a really important hormone called progesterone. And what progesterone does is it nourishes the endometrium, the lining of the uterus, as well as nourishing the embryo. It's really important to have a good corpus luteum, because without a good corpus luteum, you're not getting enough progesterone, and without that, pregnancy is unlikely to be successful. If you're serious about getting pregnant, you really need to know when you're ovulating. Ovulation occurs a couple of days before the luteal phase. So that really means you should be having sex in the days leading up to ovulation and on the day of ovulation. I recommend you keep a clear diary of your menstrual cycle length, and that way over a few months, say 6 to 12, you can work out your average cycle length. Every woman is different. Now that you know your cycle length, you'll be able to figure out your luteal phase. And the way you can do that is by measuring your basal body temperature. Basal body temperature is your body's lowest core temperature, usually recorded in the morning after you've been asleep. Once you've measured your basal body temperature, over time you'll be able to see a pattern. And what happens is your temperature should rise after you've ovulated. And that temperature rise occurs in the luteal phase. That phase starts about 2 days after you've ovulated. It helps to know your basal body temperature because it'll tell you when you're going to ovulate. It'll help you plan when to have sex and to maximize your chances of falling pregnant. Basal body temperature is your body's lowest core temperature usually measured in the morning after you've woken up from a sleep. Basal body temperature is a way of figuring out when you've ovulated, and that's going to help you figure out when to have sex and fall pregnant. When you measure your body temperature, you should notice a rise, and that rise should be maybe a 0.3 to a 0.5 of a degree. It should stay up for at least 10 days, and it staying up means that you have an adequate luteal phase, and this is a really important phase in your menstrual cycle. Moving forwards over time, when you keep a record of your BBT, you'll be able to see when ovulation has happened, because ovulation occurs 2 days before that rise occurs. The best way to measure your basal body temperature is to buy an accurate digital thermometer. And here's one I prepared earlier. When you wake up in the morning, it's really important that you do nothing first but measure your body temperature. It's literally turning to the side of your bed, picking up your thermometer and putting it in your mouth. It's really important you know how to use this properly. And it doesn't mean doing this. Now, forgive me if you can't understand what I'm saying, because I'm going to put this in my mouth to demonstrate. But it's not doing this. That doesn't cut it, doesn't work. It needs to go deep into the mouth, like that. So, in between the bottom of the mouth and the tongue. And it needs to stay there until you get a recording. Your basal body temperature is really quite sensitive. That's why it's really important that as soon as you wake up in the morning and you've opened your eyes, even before getting up, moving out of bed, that you've checked it. Don't go to the toilet, don't make yourself a cup of tea. Check your body temperature first. Measuring your basal body temperature is really important because you'll be able to see a shift in your body temperature. Over time, you'll see a pattern. You'll be able to see when you've ovulated, because ovulation occurs 2 days before that rise. And that's great in moving forwards. It'll help you predict when to have sex to maximize your chances of pregnancy. It's not your typical dinner time conversation, but your cervical mucus is completely normal, and you should pay more attention to it. Cervical mucus is made by your cervix. It's made by the glands within your cervix. Depending where you are in your cycle, there may be up to 4 mils of cervical fluid, and that's particularly around the time of ovulation. Cervical mucus has 2 functions when it comes to sperm. It can either keep sperm out or bring sperm into the uterus. Cervical mucus is the gatekeeper. It's really smart. It knows when to keep sperm out and when to allow sperm into the uterus. At occasional times it'll be dry, the beginning of your cycle, then it might be a little bit sticky, then it might be creamy, and then what you should see if you're about to ovulate is it should be slippery. So here's where you need to pay more attention to your underpants, because your underpants will give you an idea about the forecast. Just after your period, you'll have dry underpants. There'll be nothing much there at all, and this is your dry phase. Next on your underwear, you might find a bit of stickiness. Sticky mucus that might last for about 1 to 2 days, and that's in response to estrogen, and this really means you're on the path, hopefully, to ovulation. Next, you might notice on your underwear a little bit more creaminess. Now, the creaminess is secondary to a further rise of estrogen and hence more water content in your mucus. This means you're getting closer to ovulation. You've probably heard of cervical mucus looking and feeling a bit like raw egg whites. It's true. You'll find that on your underwear, it will feel and look really wet, and sometimes women have to wear panty liners. This is a really good indication that your fertile window is definitely open. Sperm love slippery mucus. Slippery mucus tells you that your fertile window is really wide open. It should be the cue for you and your partner to start having lots of sex if you're wanting to fall pregnant. In response to hormonal fluctuations, your cervix can change its position in your vagina, and in doing so, you can actually figure out where you are most fertile. Your cervix is your gateway to your uterus. It's a very important structure. It's about 2 to 3 centimeters long, it's cylindrical, and it connects the vagina to your uterus. As you can see here, it's also the gateway to your sperm. In the first half of the cycle, your cervix falls lower into the vagina. And when you put your finger in to feel your cervix, what you might feel is in fact a firm cervix, a bit like the tip of your nose. Around the time of ovulation, when you're becoming more fertile, your cervix actually changes position in the vagina. It actually rises up higher. So if you were to feel your cervix, you would find that it would feel a bit more like your lips rather than the tip of your nose. There's a great way to remember what your cervix should feel like around ovulation. It should show off. It should be soft, high, open, and wet. Checking your cervix is really quite simple. All you need to do is pop your finger in, just like when you're putting a tampon in, but without the tampon. So you're feeling around, it's really that simple. Monitoring your cervix in this way is actually a great way to help, because it'll help you figure out when you're most fertile. But it's not for everyone, so if you don't feel comfortable doing this, that's okay. There are two types of ovulation predictor kits. One uses saliva, the other urine. Today we're going to be focusing on urine. People often get the timing wrong, and then they wonder why they're not getting pregnant. The great thing about the ovulation predictor kit is it tells you when to start having sex, because you want to start having sex before the egg is released, because really the sperm should be there when the egg is released to maximize the chances of fertilization and pregnancy. These kits are a great way of you monitoring your fertile window at home. And that's really important because once you've ovulated, that egg only has 12 to 24 hours to become fertilized. So it's really important you're aware of your fertile window before you ovulate. The kit works by detecting luteinizing hormone or LH levels in your urine. Now, about 24 hours before you ovulate, LH levels surge, they rise quite quickly, and that is an indicator that you're going to ovulate quite soon. There are many different kits on the market. Just read the instructions. In general, I recommend you don't pee for about 4 hours before you use the kit, and when you detect an LH surge for the first time, that means you need to start going for it. You need to start having sex because it means the fertile window is open. People often ask me, how often should we have sex? I recommend that as soon as you detect that LH surge, have sex every day in the lead up to and the day of ovulation. That'll maximize your chances of falling pregnant. Nutrition is a very important part of pregnancy planning. Clearly, there are things that you shouldn't or should eat. There are some basic food principles that I'd like for you to follow when you're thinking about conceiving and even during when you're pregnant. Some basic principles include eating whole foods, that is, eating foods that you're able to identify as a real food, like a tomato, for example. You want to maximize the amount of nutrients that you actually eat at every meal. And the only way you're going to get that is when you eat a lot of vegetables. You also have to be mindful of how much sugar you have in your diet. You would like to actually have a balance of foods. So you're looking at whole foods such as meat, dairy, vegetables, fruits, and nuts. You'd like to also eat seasonally. And what that means is eating things in season. And that's important because you know that seasonal fruits and vegetables will actually be maximized in their nutrient density. Something that's not seasonal that you're seeing on a shelf means it's probably been bought from somewhere else. It's been refrigerated, had to come from a long way, and has probably lost a lot of its nutritional potential. Organic. Why do we go on about organic? Because organic means that the food that you're eating has less toxins and chemicals in it. That's the thing to remember. And when you're pregnant or planning a pregnancy, you want to minimize the amount of toxins in your body. Why? Because those toxins go straight through to the placenta, to your baby, and even into your breast milk. You have to be smart about the carbohydrates you're eating. Carbohydrates aren't bad. You can't just say all carbs are bad. There are better carbs than others, and that's important to realize, especially when you have a condition like polycystic ovarian syndrome. With that condition, you're more likely to develop diabetes and pre-gestational diabetes. So it's very important that you make sure that you don't have spikes in your insulin levels. And this is really vital because there are certain carbohydrates that will cause spikes in insulin and others that won't. Complex carbohydrates, they're usually vegetables and fruits, and they're more nutrient dense than, say, simple carbohydrates, which are found in things like white bread or white rice. You want to maximize the amount of complex carbohydrates over the simple carbohydrates. Fish is high in omega-3s, and omega-3s are really important for baby's brain and eye development. Nuts and seeds are a great snack, and that's because they're high in omega-3s, nutrients, vitamins, and minerals. These are the top 6 foods to avoid when planning a pregnancy. This goes for you and your partner. Soy milk. What's wrong with soy? The issue with soy is it's highly processed usually and high in estrogen. Now that can interfere with your own hormones, particularly for a man. Sugar's the white death. There's no added nutritional value when it comes to sugar. There's no reason to put sugar into your coffee. Absolutely none. Now, when I talk about sugar, I mean refined sugar, like table sugar. I'm not talking about the sugar that you find in your fruits. That's a different story. Everyone loves a bit of alcohol, red wine, vodka. I recommend you review how much alcohol you're having. What's the safe limit? We don't really know if there's a safe limit. So for that reason, I'd recommend you try and minimize your alcohol intake. And if you are going to have alcohol, make it at least something that's beneficial, like red wine that we at least know have some antioxidant in it. Processed foods. That usually means that the food has been stripped of all its nutrient capacity. A lot of the time, things are added in to make up for that. And a lot of those added in things are things like sugar, the white death. Avoid processed foods. Fast fried food. Again, absolutely no benefits to that. Avoid at all costs. Elvis Presley, who used to deep fry his Mars bars, may be just agreeing with me right now. Number 1 food type to avoid is junk food. Things like Kit Kats, chips, Mars bars. They're everywhere, easy to find, cheap, but don't do it. There's absolutely no benefit to you or your future pregnancy. Depending on where you are in your menstrual cycle, it's important to perhaps focus your attention on certain food groups. So when you've got a period, when you've got a bleed, you can lose up to 35 mils, some women up to 80 mils of blood in that cycle. So you have to make up for that iron deficiency. So where do you get iron from? Along with your meat, your leafy greens, your kale, your beans, you might make a point of putting some vitamin C on that plate. Where can you get vitamin C from? Tomato. What does the vitamin C do? It helps you absorb that iron. It maximizes the amount of iron on your plate. When eating your iron-rich foods, you may want to avoid having coffee close to that time as well, because what coffee does, it's got caffeine in it, and caffeine reduces the amount of iron absorption. So in the follicular phase, and particularly around the ovulation phase of your cycle, you might want to be mindful of what you eat, because what you eat may affect the acidity or the alkaline acid balance of your cervical mucus. We know that certain foods are more acidic. Sperm doesn't like acid, so what you want to do is avoid acidic type foods like alcohol, caffeine, a lot of meat or eggs. To promote the more alkaline side of your diet, it's important to be mindful of good vegetable intake, fruits, and nuts, as well as seeds. Eating well for pregnancy for you and your partner is really quite simple. It's not complex at all. Keep it simple, and that means just buying food, eating food that looks like it's come from nature. Avoid processed foods. Just eat things that are colourful, that are not packaged. That way you'll set yourself up for the best pregnancy ever.